Okay, we're going to be doing the cervical spine imaging, and what I'm going to show you is typically the routine cervical spine that you'll be experiencing out in clinical site. First, I'm going to start with the lateral C-spine on an ambulatory patient, and you have the patient turned sideways so that the left shoulder is touching up against the board. Have them step towards you just a little bit so that you can get the neck centered to the center cell on the bucky tray. Now I'm going to raise this up so that this central area is right in the same alignment as the thyroid cartilage. And once I line up my collimator light, I want the line to cut right across the upper portion of his thyroid cartilage, which in essence that is the area of C4. The upper level of the thyroid cartilage is C4. Now make your final adjustment here. Put your left marker on here since his left shoulder is touching up against the board. Make sure the shoulders are relaxed. The patient is standing evenly on both legs facing towards you. Now oftentimes with men, because they do have stockier shoulders, you may want to have them hold some weights. Now I'm going to give David some weights here to hold, and put your arms down by your side, and that should pull the shoulders down even more so that we can see hopefully all 7 of the cervical vertebrae in the top of T1. So that is our lateral cervical spine. Next I'm going to do the oblique cervical spine, the AP oblique. We're going to do the left, and you're going to turn your patient about 45 degrees from where he had the left shoulder up against the board. Now you want to check your crosshairs again. One change you do want to make is on the AP obliques, you want to use the 15-degree cephalic angle. So I'm going to go ahead and put a 15-degree cephalic angle. And actually you do have a range of 15 to 20 degrees. Bring that down, and you want to center it at that upper level of the thyroid cartilage. David's pointing it out for you. And then adjust your bucky tray so that it is centered with your central ray. Okay, since his left shoulder is touching, this is the left AP oblique of the cervical, and my left marker is already up there from that left lateral, so we don't have to change that. Next, after you shoot this left AP oblique, we're going to do the AP axial oblique of the cervical. You just put the back against the board, get the patient centered, raise the chin slightly, check the mid-sagittal line, and you want this line to be cutting across that upper border of the thyroid cartilage. Now, in the AP axial, you still use the 15 to 20 degree cephalic angle. So we don't have to move any of the bucky or the tube. Our marker's already up there. This is the left side of the body, so there's nothing else we need to do for the AP axial. Next we're going to do the right AP oblique. The patient's going to turn 45 degrees to the right. Now you want to get your patient centered, okay, so that this line up and down is going right through the mid portion of his neck. Okay, now since his right shoulder is touching up against the board, you do want to use your right marker. And I'm going to place this over by his right shoulder. Something you want to double check when you're doing these AP obliques is check the chin. You want the chin slightly up. And the reason for this is you do not want the portion of the chin to overlie the upper part of the neck. So bring that chin up just a little bit, and that will take care of that. Next we're going to do the open mouth for the cervical spine. And this is for C1, C2. So I'm going to raise our board up a little bit. I'm going to take the angle off the x-ray tube. Then I'm going to bring our tube in to 48 inches. And then raise the central ray to the height of where it's going to be entering into the mouth of the patient. You can see where that's centered directly right over the mouth. Double check, make sure your bucky is at the correct height. Then I can see where this central line is intersecting with the center of the bucky tray. Now, once I have it set up at this point, what we want to be real careful about checking is that occlusal line. You want the upper teeth occlusal line going straight across and cutting across this posterior portion of the base of the skull, or the mastoid tip that's right behind the ear. Those are both at the same level. So you can palpate this and just check your line that leads from the upper teeth to the back of the skull there. If you have that as a nice horizontal line, then you're ready to ask the patient to open their mouth. Open your mouth wide, and it's really important they do open their mouth wide for this one. When they open their mouth, double check again, make sure the top of the teeth is a nice horizontal line with the back of the skull here, or the mastoid tip. Now I'm going to make a small adjustment to David's head so that that line is good and horizontal. You want to double check, make sure the head is straight, because you still want the mid-sagittal line on the middle of the skull there. Okay, now I can collimate down, because we only want C1, 2. So that's all we need, is just to collimate to the open mouth. Now, because I have collimated, I do want to move my marker in more so that that marker will be seen. Now, having your patient phonate "ah" will bring that tongue down to the base of the mouth so that you can see that C1, 2 area better. Okay, you can relax.